There is nothing more important than health. That's an individual's principal capital asset, says an American author, Erin Spector. This thinking aligns with the message of the Director General of the World Health Organization, Tedros Ghebreyesus, that cancer not only takes lives, it damages families, destroys livelihoods, and cripples communities, owing to the cost of care, which exposes families to extreme financial hardship or plunges them into poverty. On this episode of Frontiers, we shall be taking a look at the global cancer burden, causes, prevention, and treatments. I am Obiageli Ugwoke, and to give deeper professional insight is Dr. Chinedu Aruah, a consultant oncologist with the National Hospital, Abuja. Glad to have you on the program.
Thank you. It's my pleasure to be here.
We will take an excerpt as a peg to today's discourse.
Records show that globally, about 20 million people are diagnosed with cancer, out of which about 10 million cases results in death, with Nigeria recording about 70,000 deaths from estimated 125,000 cases annually.
Whenever I hear or whenever someone is being pointed at, like, this person has cancer, it frightens me, and I even feel like, oh, I see the person, this person is dead already.
In low and lower middle income countries alone, 250,000 deaths can be prevented by 2030 if the 90-70-90 strategy is implemented.
This year, the World Health Organization and other relevant agencies are focusing on how to close the care gap, uniting voices and taking action.
I'm a living example. I'm a cancer survivor.
Architect Zubairu Haruna Usman Ugu told me he is a colon cancer survivor. He is lending his voice as an advocate for better cancer services. He said, cancer is not a death sentence as presumed by many.
The survival rate is a function of early detection, right treatment, and we have capable experts or oncologists in Nigeria who can handle it from beginning to the end.
The most important thing is the timing. For example, now adolescent girls, there's HPV injection we can give them to prevent them from coming down with the HPV virus, which is the common cause for cervical cancer. They also screen women that are of the reproductive age every 2 to 3 years.
With blue and orange as official colors of World Cancer Day, the Union for International Cancer Control wants the world to unite against cancer and take action to make universal health for cancer prevention, treatment, and care a reality, especially in Africa.
Once again, you're welcome to the program. Now, cancer occurs in various parts of the human body. Can you give a vivid description of what constitutes this disease called cancer?
Cancer as a disease entity is multifactorial in nature and affects every part of the body. But the major thing is how do individuals view cancer as a disease. And for me, for a definition purpose and for the benefit of this program is that we define cancer as an abnormal growth of cells or tissues that has no function to the body. There are cells that are immortal. They continue growing indefinite. And because of that, they erode the tissue and they erode the body of normal nutrients and leads to death if not well taken care of.
We have various kinds of cancers. What are common symptoms which tell that a cancer is growing in an individual's body?
Yes, it depends on the part of the body we are talking about, because cancer can occur in any part of the body. It can occur in the eyes, mouth, hand, eyes, everywhere. So it depends on the particular place we are focusing. But more importantly, we normally talk about the most common cancers. And those common cancers is the one that we usually focused on. Because if there's no need of you discussing about so many cancers that are very rare, there are some cancers that are very rare, that you may see 1 in a million or 1 in 100,000. But you can see the one that you see about 6 in every 10 patients. So that one is very common and needs our interest. And as such, we tend to mention it more frequent than the others. So, and this is the ones that we always talk about their symptoms, and talk about their prevalence, and talk about their incidence, and talk about their mortalities. So if you are coming to globally, if you are discussing globally, we are now looking at breast cancer as the most common because it has overtaken lung cancer. Earlier, lung cancer was topping the chart. Then we look at the colorectal cancer, and we look at liver cancers and non-Hodgkin lymphomas, or what we call lymphomas. So back to our place, breast cancer is the most common frequent cancer. Then we have, again, cervical cancer, we have the prostate, we have the colorectal, and we have the liver cancers. So those are the cancers that most often we are very particular about the symptoms that emanate from them. Looking at breast cancer, sometimes from the perspective of this general public, is that sometimes they say that breast cancer is just exclusively for the female, but breast cancer equally occurs in male, and that's why that when we're discussing about cancer, both the male and the female gender are part of our priority, so that everybody is fully aware of what we're talking about. Looking at the breast cancer, the most common symptom is a breast lump. It may be painful or painless. So a patient that have been there, that doesn't have any lump on the body, suddenly notice a small growing lump that is increasing in size, and sometimes there's changes in the breast that may warrant patient's attention, in which case the skin, there will be skin changes, there may be discharge from the nipple, bloody or milky discharge from the nipple, then there may be a swelling in the armpit. And as the cancer progresses, then we start seeing it getting down to the bones, leading to certain changes in the bone, what we call the pathological fracture. And sometimes it can get to the brain. We describe it as a metastasis. And when it spreads to the bone, it may lead to headache, it may lead to confusion, patient being agitated, and sometimes it may lead to seizure. So there are multiple features that you see or symptoms that the patient may present with, but it depends on how the patient is seen at the clinic. Then we look at equally the male cancers, which is the prostate cancer and most common. We may see a man who has been urinating normally. All of a sudden, you have noticed increase in the frequency of urination, and sometimes they see blood in the urine, and then some cases they may not be able to hold their urine. They are just what we call incontinence. So before they know it, they have already started urinating. Then there's also the sense of urgency, whereby the patient may be having this frequency is almost running in haste to go and urinate. There may be waist pain. Most of the common symptoms is sometimes the patient will notice waist pain. So when a man that is having of almost 40 years and above is noticing waist pain, he should not ignore it, because that may be a symptom of prostate cancer. Yes. There are others like colorectal cancers that have to do with cancer of the large intestine and the rectum. So in that case, there's a change in the bowel habit, whereby the patient may not be able to pass through, or sometimes they may have something like diarrhea, frequent diarrhea, or frequent constipation and diarrhea being changed intermittently. Then they may see stool, blood in the stool. So in that case, the patient needs to go to the hospital, and when he gets to the hospital, the doctors will evaluate them with appropriate lab test and examination.
All right, so making yourself available for checks, it's one of the key to early
we'll call it
detection.
Health-seeking behavior, because I would say in general terms that cancer is curable.
Okay. Now let's look about the causes. What causes cancer?
Okay. Just as we mentioned that it depends on the particular cancer you're looking at, but that we can now discuss about the causes. But in general terms, we can say that maybe we can looking at smoking. Cigarette smoking is one of the risk factors of cancers, especially head and neck cancers. We may talk about alcohol. Increased consumption of alcohol can lead to stomach cancer, can lead to this colorectal cancer I mentioned, can lead to liver cancer. Liver cancer most often is very deadly, and in some cases is not easily amenable to cure. Then we have cases of nulliparity. A woman that has not had baby before, have not had baby for quite a long time, maybe in her 35 and 40 years of age, not had baby before, or not pregnant before, then the risk of developing breast cancer is quite high. And the patient who have been on contraceptives for quite a long time is at risk of developing breast cancer. So there are so many things that cause cancers that if we start naming them, there are too many.
Okay, now of course we have to talk much about it, because the more you educate people on it, the more they are more careful about their lifestyles.
Yes, we can go ahead, like mention a particular cancer. We now talk about the risk factor. Like if we talk about cervical cancer, we can talk about how it is equally age-related, low socioeconomic factor, and exposure to human papilloma virus, which is the causative agent of the cancer. Most of them, they have different serotypes, but the most common that is causing cancer in environment is serotype 16 and 18. So, and this is one of the preventable cancers all over the world, in which if you have access to vaccine, what we call human papilloma virus vaccines, you can create what we call herd immunity, in which people are less predisposed to contracting it, especially if given to pre-adolescent males and females.
Now, it is often said that happiness lies first of all in health.
Yes.
Is there a correlation between unhappiness and the development of cancer?
Yes, there's some state of mind that can really actually lead to cancer, like somebody that have a suicidal tendency, who is depressed, who is not psychologically balanced. Before you know it, the cells start assuming the status that patient have already placed himself. So in that case, there may be some changes that suddenly occur in the body that may lead to development of cancer. So there's a correlation sometimes between the patient's state of mind and development of cancer.
Okay, now let's bring the reality of this disease closer to Africa. Statistics indicate that 1.1 million people suffer of the disease on the continent alone, with 7,000 deaths, while Nigeria is one of the countries in the world with the highest cancer mortality rate. Now, what type of cancer are prevalent in Nigeria?
In Nigeria, we have about 125,000 new cancer cases every year, and more than 70,000 deaths every year.
That's outrageous.
Yes, but those statistics are almost, I would say that they are even less, because they are mostly hospital-based statistics. So if you are able to go to the villages whereby you look for cause of death, you may find that the data is, the rate may be higher than what we are mentioning. So, but the majority of the causes of cancer mortality in Nigeria is just around the 5 most common cancers in Nigeria, which include the breast, the cervical cancer, the prostate, the colorectal, and liver cancer, and lymphomas. So these are the most common cancers that are almost contributing more than 80% of the cost of cancer death in Nigeria. Though that does not mean that we don't have pediatric cancers, that cancer of the children that leads to death. But when we're talking about adult cancers, these are the most common cancers.
All right, I'll get back to you. Let's pause for You're watching Frontiers, and we're taking a look at World Cancer Burden. The conversation continues after this break. Thank you for staying tuned. All right, now let's take a look at this year's International Cancer Day. The theme of this year's celebration is Closing the Gap, and it is a 3-year campaign for impact. It is aimed at creating a future without cancer. This brings us to the aspects of prevention. Now, can this chronic disease be prevented?
Science have discovered that there's some modifying behavior or lifestyle modifying behavior that can actually influence the progress of the disease, the likelihood of developing the disease, and likelihood of getting cured of the disease. So that lifestyle modification means that is something that a patient introduced or somebody who has not had cancer will introduce and able to obey such, and then the risk of cancer is now become way, way down on the list. So, and that includes weight reduction, because obesity is one of the risk factors of developing breast cancer, colorectal cancer, endometrial cancer, and cancer of the liver, and many other cancers. So you can see that weight reduction, which is good dietary control, eating balanced diet, then exercise. Exercise, you tend to burn off excess calories. Then avoiding smoking, then avoiding pollutions, because pollutions lead to head and neck cancers. So you can see that when you have a good environment, clean environment, you have reduced cancer to a reasonable extent. Then you now talk about vaccination, vaccinating young girls and young boys, especially for to prevent development of human papillomavirus and the prevention of cervical cancer and penile cancers that normally occur in men who are exposed to human papillomavirus. You see that when a country now choose to expand their vaccine, access to vaccine, then the chances of reducing certain cancers becomes possible. Like the one we equally give that equally prevent hepatitis B virus infection. So when you give it, then the chances of preventing liver cancers, because hepatitis B virus infection can induce liver cancer. So if we're able to give that vaccines, then we are preventing that. So those lifestyle modifications are things that we're now doing that is now leading to reduction in cancer rate. And is now part of what we call preventive measures that people take to make sure that they don't develop cancer.
Okay, it's been identified that one of the major ways to defeat the disease is through research and innovation, and then extraordinary breakthroughs in medicine, diagnostics, and scientific knowledge. What is the scenario like in Nigeria in the light of this?
Well, I will say to quite a reasonable extent, Nigeria is one of the developing countries, and government is taking steps to make some reasonable input into cancer research, like the recent signing into law, the National Cancer Institute and Treatment, which the president signed into law. There's going to be a cancer institute whereby such research is going to be taking place, and a lot of hospitals, that's radiation oncology centers, that are now being furnished with some of the treatment equipment. So the issue is that we are having what we call a kind of brain drain, and that brain drain is going to affect delivering of this research and having enough manpower to cater for increasing number of patients that develop cancer. And those who are already at home, who have decided to stay back because they see the reason that Nigeria patients deserve best service. Even if they are giving the best service in UK, America, and rest, we feel that the citizens of this country always deserve the best service in terms of cancer care. So such people should be looked for. Then government go extra mile to make sure that they empower them into research and publication of some of the findings. Then the situation is a lot of people are limited because of to do some research. You need a lot of money to fund it. So funding is one of the problems that we need to handle very well, and support and mentorship. So with that, I think Nigeria will move ahead better than what they are doing now.
The World Health Organization is so committed to closing the cancer care gap, particularly in women and children cancers, with a global breast cancer initiative framework, which is for generational investment. How can Nigeria benefit from this initiative?
Nigeria is going to benefit by, first of all, putting their house in order. How they are going to put their house in order is making sure that some of these radiation oncology centers we have are fully functional with research labs, whereby the funding, because when the World Health is investing, they want to see where the money is going. So, so once you have a functional system and you are bringing out a product out of that functional system, they are ready to put in their money there. So as far as breast cancer is concerned, is a cancer we say that is already most common in Nigeria and almost the most common in the world. So the interest is quite high. So what we need is now more manpower, more research institutes, and more commitment from the government and the private sectors in terms of assisting the healthcare givers to do the needful.
Now, you attend to many cancer patients on a daily basis, just like we're discussing initially at the facility where you work. What's your advice to Nigerians to bring down the rising cases in the country?
What I would advise them is that, first of all, we need to develop first is health-seeking behavior, whereby people normally go on a routine medical check. Because majority of the people that, majority of patients we see present very late. And the presentation with in the clinic with other challenges that are associated with cancer makes curability very, very low. But for those who presented very early, we see a good outcome. And
the chance of survival is
higher. Very, very, very high. So I will advise them that first of all, they develop good health-seeking behavior, and they're able to go to hospital for routine health check. People tend to stay almost over 5 years without going to hospital for even a single day to have a health check. And what you see that somebody suddenly slump down and die. That is not what's supposed to be. Because if you are in the overseas, you have already a GP assigned to you so that you do your health check routinely. So we should equally on our own develop that idea of going to the hospital. And at the same time, we should equally know that health is wealth, and we should not leave health, investment in health only to government. In other places I've been, India, Spain, US, London, Germany, we see private individuals investing in health. If not even not investing in health, you see them donating to the health facilities. Coming to health facilities and asking them what they lack. And with that, they were able to furnish the hospital and it becomes state of art. So we can do that. I think Nigeria has all the potentials to have one of the best hospitals through this charity organization and through free will donation. So I implore our rich people, our rich men and rich women to occasionally visit some of these hospitals and they're able to donate or sponsor or lay a foundation for a particular research and put in some money there and commit some people. They were able to give you a result. And with that, Nigeria will grow and the health system will grow.
All right, thank you very much, Dr. Chinedu Aruah. We most appreciate you on behalf of the entire production team for sharing your thoughts with us on the causes, prevention, and treatment of cancer. We look forward to a time when Nigeria will finally and completely be able to defeat this disease.
Thank you. Appreciate it.
Experts say the battle against cancer can be won through increased public and political literacy and understanding around cancer, reducing fear, dispelling myths and misconceptions, as well as lifestyle modification. I will leave you with this charge: eat lightly, breathe deeply, live moderately, and cultivate cheerfulness. I am Obiageli Ugwoke. Thank you very much for staying with us.